Welcome back to Western New York Living and the Big Weck Radio Local Business Spotlight segment.
Welcome back to Western New York Living. Now, you'd probably think that taking it easy or just relaxing might be the right thing to do for back and spine pain. While that can be true, inactivity can also cause perhaps sometimes more pain and stiffness than you originally had. So how do you know when to relax, when to seek treatment? Your body always has the answer to that question. And for more answers on that question and other pain-related questions, we have Dr. Christian Milioto here from the Western New York Pain Relief and Integrated Wellness Center. Good to have you back here, Doctor.
Pleasure as always.
Well, let's talk about the inactivity of winter, because a lot of people have, maybe they are unable to get out and exercise more, like to do it outside. What can the inactivity do for those who are experiencing back and neck pain?
Inactivity is the worst thing. The biggest problem about chronic pain is when you have chronic pain, you lose function. If you lose function, you can't stand or walk. You find be a little bit more comfortable when you're not doing anything, sitting and laying down. And that actually starts to intensify the pressure on the nerves, which will cause more atrophy, more muscle wasting, and a lot of people start to develop balance issues or difficulty standing and walking short or long distances.
So that's why it's important to be under the care of an expert or under a doctor to let you know, like, okay, hey, this is going to be okay. You need to get moving here, sitting down, or along with that, listening to their body too, so important, isn't it?
Yes, the biggest thing is I used to have disc and nerve issues, okay? Terrible car accident in my 20s. I was a surgical patient. I saved my own life, okay? When people are suffering with disc issues, if you have sciatica, if you feel numbness, burning, or tingling in your body, you can't take a medication to treat it. You need therapy that can help that tissue heal. Most people are told you can't. You can't heal a tissue and you need surgical intervention or you need epidurals. You absolutely do not. The way medicine is, yes, typically you may fall in line with a neurosurgeon before you advocate for yourself. But the patients that come to us are any and all ages, any and all type of metabolic diseases, diabetes, previous cancer patients. We are helping people not only get rid of their pain, but restore their function, get rid of medications, and simply give you your life back. And you need to give yourself an opportunity to come in for an evaluation.
How many patients do you see that have waited and perhaps waited too long?
Oh, 95% of the patients I treat, typically ladies, if you're listening, you guys are the smart ones. When ladies have pain and they can't take care of themselves or their loved ones, they're seeking care. Guys, we're a little bit slower. Typically my guys sometimes are crawling into my office. But the big thing about it is it doesn't matter how severe your problem is, we can address it. And if you think you're too old or you've been told you have arthritis and you have inflammation and you have to take this medication or keep doing therapies that aren't working, come in. You will meet people and patients who have changed their life in a very short period of time, and you're one call away from that opportunity.
All right, and earlier the better, fellas. I'm one of those guys. Arthritis, some folks, it's just arthritis. There is stuff that can be done for it, right?
Oh, absolutely. We have two of the most advanced treatments for disc, nerve, and inflammatory disorders. You can control inflammation. Arthritis is not the reason why people have pain. We all have arthritis in our body. Why do some people have pain though? That's from the inflammatory process and how that tissue in your body is being affected. And yes, you can control arthritic inflammation. You can restore function to a bad shoulder or a bad knee or a bad hip to an extent. Okay,
Sure,
sometimes it surgically needs to be intervented. But there are opportunities that people should take before they start getting things like epidurals or steroid injections that actually cause the tissue to break down faster, which will rush you into that surgery that you're looking to avoid.
These are things that they'll learn at the free seminars you hold the third Wednesday of every month.
Yes, come into the seminar. Everybody will be gifted my published book on healing the root of back pain. It'll explain to you disc and nerve disorders. We're going to have lunch. It's actually a lot of fun. This is not a boring thing. You are getting an opportunity to make decisions about where your life is going to go in the future.
All right, you will need a reservation for that at Western New York Pain Relief and Integrated Wellness Center. They provide regenerative solutions for back, nerve, knee pain, neuropathy, arthritis. Their offices are located at 4415 Union Road in Cheektowaga. Give them a call, 650-PAIN. Also head to their website at buffalopainrelief.com. Learn more about all the different types of treatments they offer. You saw in the video there some high technology too. Next free seminar is going to be held on Wednesday, March 18th, 1 p.m. You do have to call to register for that.